now have Rebecca Penders, and she's going to be talking about how trans ideology impacts the disabled woman.
There are a lot of topics I can talk about today. I can talk about growing up a tomboy, being bisexual, and how, if I had been raised today, I would have likely been sucked into gender ideology and subsequently been enabled by the medical industry to poison my body and amputate my breasts. I could talk about men and women's prisons and what a human rights abuse that situation constitutes. I could talk about the recent mass shooting in Tennessee and how a trans-identified woman murdered 3 children and 3 adults in a burst of male pattern violence, with testosterone use being a likely factor. It may have been mass shooting number 130 in America this year, but it was the first ever to be committed by a woman. But I'm going to speak about what I know best, which is being a woman and being disabled. I'm going to talk about how trans ideology intersects, to use a popular term, with disability, and how it impacts both disabled and non-disabled people, trans-identified and non-trans-identified. I was diagnosed with multiple sclerosis 11 years ago at age 21. My first flare left me with permanent paralysis in my legs and hands, chronic nerve pain and spasms, visual issues, urinary problems, and more. I've used a wheelchair full-time for a while now. I'm a petite woman and have always been aware of my physical vulnerability, a situation which was made more dire after puberty when I received unwanted sexual attention from men and boys, as do all girls and women. But since becoming disabled, I was reminded of this fact. I am more risk than ever before, and I do not go many places without my male partner to protect me. I was reminded of this fact very recently when I went to Savers, an American thrift shop chain. Because of my aforementioned urinary issues, I needed the bathroom very suddenly and discovered that they had turned the women's lavatory into another ostensibly gender-neutral bathroom for employees. In effect, they only had a men's room now. If I could have waited, I would have, but instead I had to make sure that my partner stayed with me and discovered that both the stall door and the bathroom door would not lock. So he had to hold the stall door closed. Someone came in, my haunches went up until I realized it was a woman. She sounded like she was running on more adrenaline than I was, having no bodyguard, and bolted like a bat out of hell. I had the bizarre urge to apologize, even though that would have been strange from the stall, but I did talk to my partner to make it clear that he was with a woman, and I hope that gave her some solace. I felt very helpless. As I rolled out of the stall, ignoring the sink, I realized with horror that a strange man was peeing into the urinal feet behind me, and I almost ran over my partner's feet in an attempt to escape, squeezing by 3 other men who towered above my seated form. I ran on rage until I got home, but then I collapsed into a panic attack, which was very unexpected. For anyone who's experienced the threat or consequences of male violence, this situation is untenable. There were little girls in that bathroom, in that store, and if they would have had to walk past grown men if they wanted to pee. This in particular made me apoplectic, along with the evident terror of the other woman who fled so rapidly. We deserve to feel and to be safe and to have our dignity and privacy respected and to be able to deal with menstruation, small children, changing diapers, catheters, endometriosis, and more without men looking us up and down. I've been dreading this situation for years now, but part of the reason I have escaped such circumstances is because disabled bathrooms are often separate rooms entirely and sex neutral by default. I am always grateful when this is the case, as I never know when a business has decided to allow men into their ladies' rooms. Not everyone who needs the disabled bathrooms uses a mobility aid, so it is impossible to tell whether or not someone has, say, urinary difficulties, and so needs the accessibility. However, for years now, every time I see a woman using the disabled bathroom without a mobility aid, I wonder whether or not she's using the separate facilities in order to avoid the potential threat of men. And I welcome any woman who is using that rationale to do so for her own safety. Another issue with the epidemic of trans-identification is that many trans-identified people will also be using the single-use disabled bathrooms in order to avoid using the bathrooms designated for their birth sex. And these bathrooms are few and far between. In 11 years, I have never been to a place that had more than one disabled stall or bathroom. To be fair, many of these trans-identified people would in fact qualify as disabled, and not simply in the sense of being mentally ill, but also because of the hormones and surgeries are quite disabling to the human body, which I will come back to. I do not rely on hired caregivers to assist me, but many disabled people do. And disabled women are now being given the choice of either refusing life-sustaining care or allowing a man to conduct intimate procedures like dressing, bathing, and using the bathroom. Take the case of Helen, her name has been changed, a severely learning disabled girl in the UK. In 2020, her parents received this message from the school. A decision has been made to remove cross-gender consent from the personal and intimate care policy, which is in line with legislation and guidance relating to equity and diversity. Talk about Orwellian language. This intentionally obfuscating claptrap took away Helen's right to be cared for by a member of her own sex. Male members of staff were now allowed to take Helen behind closed doors with ample excuse available, and the nonverbal child would be unable to communicate her trauma if something did happen. Women and girls like Helen are fully reliant on others to care for them, not just physically, but also emotionally, and they are the most vulnerable, those without a choice. I know many women who can use their voices to advocate for themselves, but their bodies require them to be more dependent on others than is typical. These women are also at great risk, and I would be one of them if I didn't have my partner and family to create an accessible environment for me. Were I living alone, I would have no choice but to check myself into a hospital or nursing home during extreme flares and would be at the mercy of male staff while experiencing near complete paralysis and debilitating fatigue that may be confused with narcolepsy. I think I would opt to stay home, despite the fact that I have needed oxygen during a flare before. Disabled women are already at a higher risk of sexual assault. Women put in this situation have their risk increase even more. And women, disabled or non-disabled, are now faced with the possibility that their attendant at the gynecologist or urologist may, in fact, have a penis. The last topic I want to touch on is how trans-identified or formerly trans-identified people are disabled by trans ideology. So-called medical professionals have created an iatrogenic pathology, one caused by the doctors themselves, known as gender dysphoria. This ephemeral diagnosis is used as a justification to prescribe experimental hormones that have irreversible consequences, and to perform surgeries that make Dr. Frankenstein look like a circumspect and considerate physician. These are creating lifelong disabilities. With these procedures, they're creating lifelong disabilities with these procedures, similar to the devastating consequences engendered by the lobotomy craze of the 40s and 50s. Another example of the medical industry using a psychological diagnosis to justify invasive treatments, making a travesty of the term. Women and girls who take testosterone risk fatal blood clots, uncontrollable weight gain and sleep apnea, abnormally high cholesterol levels, and high blood pressure that make heart disease extremely likely, chronic pelvic pain, and an increased sex drive that can end in frustration as testosterone deforms the female genitals, enlarging the clitoris in a way that can make arousal and orgasm unbearably painful. This frustration may be channeled into their increased aggression, and we saw the potential consequences of this in Tennessee. However, women and girls are more likely to take this aggression out on themselves, implode instead of explode, making suicide much more likely. If they do not have a hysterectomy, they are at a very high risk for related cancers, and if they do have a hysterectomy, they are thrown into early menopause, with all of its emotional and physical trials, not to mention sterility. Sterilization becomes a cash cow for big fertility as it necessitates surrogacy and by extension IVF, as well as creating a whole new market for reproductive organs, particularly uteruses and placental umbilical cord tissue, which is used in regenerative science to create stem cells. The double mastectomies touted as top surgery are ghastly enough, with the majority of patients experiencing complications such as inevitable nerve pain, mobility issues, and localized infections that often turn septic. But the most medically irresponsible procedure of all appears to be the bottom surgeries, phalloplasty, where they create a Frankensteinian approximation of a penis, usually from muscles and skin removed from an arm or leg, flayed to the bone, or when they bury the clitoris, ending a woman's capacity for sexual pleasure. This procedure almost always ends in urinary issues that may necessitate catheterization. And as someone who needs to catheterize because of MS, the fact that doctors are doing this to people voluntarily makes me incredibly angry. Puberty blockers impact bone density and brain development and were first used as end-stage prostate cancer drugs. They are also clinically prescribed to castrate sex offenders. Lupron is notorious for being prescribed for precocious puberty, and many women who were prescribed the drug as young girls are now reporting serious issues of bone density and joint issues. A 2009 study showed that Lupron caused bone thinning in girls treated for precocious puberty. And in 2005, it was shown that men prescribed the drug for cancer had an increased rate of fractures. This evidence is seemingly ignored in the name of trans ideology. A Swedish documentary detailed the case of 13 children giving puberty blockers who are now suffering from catastrophic injuries as a result, including liver damage, unexplained weight loss, mental health issues, and skeletal damage and a failure to grow. Chloe Cole is one such child that was put on puberty blockers at 13 after deciding that she had felt like a boy, quote unquote, and after her parents had been manipulated by doctors into agreeing that this was the best course of action, that they would rather have a live trans son than a dead daughter. A surgeon removed Chloe's healthy, still developing breasts at the tender age of 15. And less than a year later, in the wake of incredible medical trauma, she realized that she had made a mistake. But unlike having a goth phase or even cutting, which leaves scars, Chloe will never be able to breastfeed her children if she is able to conceive them at all. Her voice is permanently masculinized by testosterone, and while she still has a melodic voice, it must be hard for her to sound and look so different after such a short period of illusionment.